My name's Cheri Thompson, and I'm the nurse injector at Lawrence Plastic Surgery. And this is my patient today, Steph, and we're going to do Botox. Steph has never had Botox before, and what we've decided is we're going to inject her glabella area, which is, if you'll frown for me a minute, it's here. It's this area that looks like a frown. So when we inject, you would say, okay, if we just inject right in the middle, it'll take care of the frown. That little area is a muscle in itself. It's called the procerus. So what we have to do is this eyebrow and this eyebrow, bring that together. So we have to use the muscles that are on top of those eyebrows, which are called the corrugators. So to inject this area, it takes about, usually, 5 injections. So first I just want to do a little Botox 101. And some people think that Botox is sort of magic, and it's not magic, but it works very well. So we'll use a piece of paper. When we're young, and in our 20s and 30s, when we make a frown or an expression, it makes a slight little crease and then it snaps right back because we have so much elasticity and collagen, and everything just kind of snaps back into place. As we age and we make that same expression repeatedly, with repetition, we've kind of earned this line. And that's a static line. That's a line that's in our face or where we're making our expression, and it won't go away. Botox really doesn't work on static lines. It works on lines that are making, it works on muscles that are making that expression. Having said that, static lines do soften a bit, so all is not lost. But the way that Botox actually works is there's a little messenger in between the muscles. It's called the synaptic cleft. And the messenger, the name of it is acetylcholine. So Botox comes in and kind of competes with that messenger. So the muscles don't get the message to contract. So as we go on and have Botox about every 3 or 4 months, we don't want the rest of our muscles to atrophy, but we wouldn't mind if our glabella did. So they're a teeny bit weaker. So they, even between Botox, or as it gets a little to the end of when the Botox is still working, that muscle contraction isn't quite as strong. So remember that when you're making that contraction, like here, frowning, or smiling up with these laugh lines, or lifting your eyebrows up on that frontalis muscle, that's times when Botox can work. So, are you ready?
I'm ready.
What I'm going to do first is mark and measure Steph, and I do that for every patient. We go about 1 centimeter above the orbital rim, and we measure in there, and we'll get all the markings done. Then I'll use a little ice and cool the area. It just makes it feel a little bit better. And we also use a real small needle. Generally, we don't see bruising from Botox. You know, occasionally there's a little capillary that we just can't see, and you may get a small bruise. We'll go through post-injection instructions when we're done.
Okay.
So I like to lay my patient back to inject. There's no real wrong or right way, so you can come from the front of the patient and inject. I just kind of like my patient maybe not to see the needle as much, so that's why I inject with the patient laying down. I'll put your head down a little bit. So now we're going to clean the area off. And now, Steph, I'm just going to mark you. I mark and measure every patient. I probably know 1 centimeter in my sleep, but this is the way that I do it. So go ahead and make that. You can relax. And then I'm just going to mark, and if you remember that little muscle there is a procerus. Then we go about 1 centimeter above the orbital rim, and we mark here. Now look up at me, okay? That's good. We want to make sure we stay kind of in that mid-pupillary line there. So that's the area, that's the whole area is called the glabella. So a little ice feels good. Sometimes people really want a lot of ice, but sometimes people get a little brain freeze, so we just kind of moderate this a little bit. Is that feeling okay?
Yes.
Okay. And then we'll start. Okay, big stick here. Okay. Stick. Sorry. Stick here. Sometimes these lateral ones are a little bit more uncomfortable. Are you doing okay?
I'm fine.
Okay. And a little ice. Okay, stick. Okay, one more injection step. Cold. And last one, big stick. Okay. That's all. Done. How did that seem?
It was fine.
Was it okay?
Yes.
Yeah. She has a couple little marks here. For a while, you'll look a little lumpy bumpy there, and that's just the fluid that needs to dissipate. Within about 15 or 20 minutes, that will go away. You'll maybe have a few little injection marks. Those will not result in bruises on Stephanie. So tonight, I want you to sleep on 2 pillows. It's good to have your head elevated. And I don't want you to work out today or tomorrow. We really don't want to get that blood pressure elevated. And I kind of call it, I tell my patients that you're kind of in limbo. Because remember when we talked about how that Botox has to go in and find that little acetylcholine and kind of compete with it, that doesn't happen overnight. It generally takes, 5 to 7 days. I mean, I have some patients who say in 3 days they're fine. When I personally get Botox, it takes well over a week, because you look in the mirror and you're making the contraction, and then pretty soon it gets weaker and then it sets up. So, and then I don't want you to rubber massage the area. And, call me if you have any questions or concerns.
How long does Botox last?
Botox generally lasts about 3 months. That's kind of, when we see the Botox literature and when our patients are calling to make an appointment, it's about 3 months. Some patients, it lasts longer. You maybe get 4 months out of it. And some of those patients are patients that have been coming on a regular basis. So we know, as we talked before, those muscles might be a little bit weaker, so that contraction isn't quite as strong. So Stephanie has never had Botox before, so we'll follow her and see how long hers lasts. Range. I have patients in their late 20s, early 30s, and I also have a patient that's 80. So when we're talking about the younger patients, we're talking about that generation that probably won't have lines or very many lines as time goes on. If they're using that and some Retin-A, it might be our generation that ages really, really well for as far as lines go. So.
I have one more question.
Okay.
I'm taking 2 medications. Is that a problem?
So taking medications is not a problem when you're injecting Botox. It just depends on what the medications are. If they're for high blood pressure, we want to make sure that the patient's blood pressure is fine. The problem for some medications is taking any of the non-steroidal anti-inflammatories, which are like Advil, naproxen, and so forth, and also any type of aspirin product. Tylenol is perfectly fine. If you are taking a baby aspirin because your cardiologist told you you have to take a baby aspirin, then take the baby aspirin. We don't want to take you off anything. And generally, the first time you come in for Botox, it will just be a consultations, which by the way are complimentary. So we, I'll talk to you about your, what you want injected, what we feel as making a plan together. And then we'll go through your medical history and your health, and then we'll decide whether you're a candidate for Botox. But most people are.
Cheri, you just injected the glabellar region. What other areas do you commonly inject?
So other areas, so Botox works the best on the upper third of the face. Occasionally I do a little injections above the lip, which we call a little lip flip, but the upper third of the face. So that means the glabellar region. Now lift your eyebrows up. So here is called, this region of the muscle is called the frontalis. We inject this, it's very frequent to inject that as well. And then smile up, and then laugh lines. I hate to call them crow's feet, but if they come in and they want them all injected, it's the first time, I generally don't do that. I generally like to see how the Botox works, and then they'll come back and say, I loved it here, can I have it here? And we say sure. Because our goal at Lawrence Plastic Surgery is to make sure that you look like yourself. We're unique, we want to look like ourselves, only just maybe a few years younger. So that's the main areas. If a patient can't decide between their glabella area and their laugh lines, I almost always have them choose the glabella area, because that's the area that generally has a negative connotation. It's like the sun's in my eyes, the kids are driving me crazy, the computer broke. It's always kind of negative. When you smile up, this is a pretty positive connotation with you have laugh lines. And also, they're on the periphery. So it's not straight on. When we look at someone straight on, this is what we generally see first.
Cheri, how many years have you been injecting? And what sort of experience have you had?
So, I'm an old nurse. I've been a nurse and a nurse anesthetist since 1978. I started at Lawrence Plastic Surgery in 2006. So I've done, thousands of injections. I have hundreds of patients and really have such a nice relationship with them. And so if experience counts, which we at Lawrence Plastic Surgery, that's kind of our mainstay, then I'm your gal with experience. So every individual is a little different. That's why I really need to have you come in and assess, how strong your contraction is. Men take more units than women because their muscles are a little stronger. And yes, I do have male Botox patients. But generally, in this glabella area, it's 20 units. And that is just kind of standard. A lot of times there's 25 units and maybe even 32 units here. We also have specials that we run on Botox, like today. And also we have a program through Allergan, which is the maker of Botox. It's called ALLE, A-L-L-E. And it's a really nice perk for the patient. Lawrence Plastic Surgery doesn't get anything out of it, but we kind of are the catalyst for the patient to get at least $20 off on their next visit. It's right off the bottom line, and our receptionist helps the patient do that. You don't have to send in anything or coupons or anything like that. It's just a nice perk for our patients to have. Once in a while, we do get a patient that feels like, maybe it wore off a little bit too soon, or feels like it didn't smooth it out. I always tell my patients, if you have questions or concerns, come back. We can touch it up. You might need a little bit more. Or maybe the patient says, right after that I went and had a massage and I had my head down in the horseshoe part of the massage. So sometimes people kind of do their own thing after Botox, so we need to make sure that they follow the instructions. But most generally, it's correct in the assessment. Sometimes it does need a little more, and we're glad to do that touch-up. Just give us a call, because we don't know if you don't let us know. So Steph, most patients, the majority of the patients do really well with Botox. And you know how to call us, you know where we're at, we're always going to be here, someone's always on call. I actually have had a couple patients that came to me for the first time and then said, but it's not my first time for Botox. And then I kind of asked, where did you get Botox before? And they said, well, it was offered on a cruise ship. And, you know, I said, oh my gosh. So they had a friend who got it on the cruise ship. And then, of course, the cruise was over. And the patient didn't have really good results, had a little bit of a heavy brow and a little droop of the eye. Unfortunately, that's really hard to track down who gave the injection and what was actually used and how many units. So re-injecting that patient makes it more difficult because we have to be very cautious. So we want to, you know, don't get Botox on a cruise. Just go enjoy the cruise and come back here for your Botox. So I want you to go home, enjoy your day, take it easy. Don't work out, and call me, and I'd like to see you in a couple weeks, and we'll see how that sets up for you.
Okay.
All right.
Thank you.
Thank you so much.